Abortion pills will be more widely available under a new FDA rule that will allow certified pharmacies to dispense the two-drug regime to people who have a prescription. Previously, one of the pills was only dispensed by doctors, clinics, and a few mail-order pharmacies. Chains like CBS and Walgreens say that they are currently reviewing the changes. So here to discuss is Dr. Kristyn Brandi. She's an OB-GYN who provides abortion care in New Jersey. She's also a fellow with the American College of Obstetricians and Gynecologists. So thanks for talking to us about this. How does this decision by the FDA change things for women?
Thanks for having me. I think this is a monumental decision, and it's really going to increase access to these pills. Before, there were a lot of restrictions on the access to mifepristone, the first of two medications to provide medication abortion. Things like having to go in person to a clinic. And so these new rules in the REMS criteria allow people to be able to actually prescribe this medication, just like you can get all other types of medications prescribed. So I'm really excited about this new information, and I think there's more to be done. It's a great first step.
So, doctor, how do medical abortions work, and how are they safe?
Sure. Well, medication abortion, first of all, is incredibly safe. It has a 95% or more effectiveness rate, and it actually has fewer side effects than a lot of things that you can already get, things like aspirin and penicillin. They work by two medications, mifepristone, which is a medication that helps the hormone that helps pregnancy grow. It blocks that pregnancy hormone. And then the second medication that you take 24 hours later is called misoprostol, and that helps expel the pregnancy tissue. Again, this is an incredibly safe, evidence-based regimen of medication, and it's something that many people seek in order to end pregnancies.
So I don't know if you know this because we're talking about a very recent FDA change, and so we don't know exactly all the implications, but we know, because we've been talking about the number of states that have been implementing restrictions on abortions. Do you know if the abortion pill is going to be treated the same way as going to a clinic to get an abortion in a state where it's illegal or highly restricted?
Sure. Unfortunately, yes. Where there's rules around gestational age or other types of restrictions, regardless of the type of medication or type of abortion that you have, whether it's medication or a procedure, a lot of these regulations and laws will ban that care. Currently, in the United States, we have 18 states that, even though the FDA has overturned these rules requiring people to go in person, 18 states still mandate that you have to go in person. And so there's still a lot of work to be done on a federal level, perhaps, to pass laws to allow people to access the care that they need and deserve.
So what would you like to see happen next?
So there's a couple of things I think that could happen. One is overturning all the REMS. This did remove some of the restrictions around medication abortion, but there's still a lot of work to be done. This is a medication that actually, for other indications, can be prescribed already. And doesn't have any REMS restrictions. And so hopefully overturning all the REMS criteria so that way people can access this medication as they need it with the help of their providers, and having federal legislation to help protect this care, overturning some of these state bans so that everyone can access the care that they need.
So, doctor, before we let you go, though, I think we have to make a bit of a clarification because people always sort of confuse two things often. There is Plan B that people may have heard of that is available without a prescription, and the abortion pill. They're two different things. Can you explain the difference for us?
Absolutely, and thank you for bringing that up because it's a common question that I get from my patients. Plan B and mifepristone are two entirely separate things. Mifepristone ends a pregnancy. Plan B, or levonorgestrel, is a medication that will delay ovulation. And so if you were to give it to someone that is not pregnant, it should work. But if you give it to someone that is pregnant, it will not end their pregnancy. And so it's a very common question. They're two entirely separate things. But there's a lot of concerns about how laws that ban abortion may try to ban other types of care, like emergency contraception, like Plan B, like other types of contraception. And so I'm hopeful that we can create legislation that helps protect all access to reproductive health care.
Important information from Dr. Kristyn Brandi. Thank you, Dr. Brandi. Appreciate it.
Thanks for having me.